Hi, my name is Dr. Donna Milavetz. I'm the founder and CEO of OnSite Care, and we put primary care clinics in large employer groups. I started the company in 2006, and we opened our first workplace clinic in 2007, really wanting to do an experiment to see if this idea of medical home model worked in large employer groups. Really in 2011 is when we decided that the experiment works. We're showing year-over-year savings for our clients and decided to launch the company since then. So from 2011 to now, we've had the pleasure, or maybe the scary pleasure, of having 100% growth year over year in terms of our growth revenues. And it's been an adventure for us in opening sort of 4 clinics every year, moving into another state, Arizona. We moved regionally last year, and it's been a great adventure for us. So I think the idea, and again, we have to go back to 2007. This is pre-Affordable Care Act, where high deductible plans were just starting, cost shifting to employees from employers to help deal with these rising or escalating healthcare costs, that we really wanted to say, okay, is there a way that we can get our hands around the cost of healthcare? And is this idea of taking care of a closed group of people, otherwise known as population healthcare now, does that really make a difference? And really, the first year, everyone said, oh, it's just a fluke. It's the business cycle of healthcare. Year 2 and year 3, when we still had a medical loss ratio at about 60%, which was really unheard of in the industry, that was our aha moment to say, oh, we've got this. We know how to do this. This is a great model to move forward, and let's take this to a regional and ultimately national scale. I think our biggest accomplishment is actually starting a healthcare company in this state, where there's a lot of very big players in the healthcare industry, and being successful in the marketplace. I think it's all about the people for us, both patients as well as our employees. So hiring exceptional talent at the provider level and at the clinic staff level, the support staff behind it, but always remembering that at the end of the day, it's about our patients. It's about patient care and giving the ultimate customer service, which is a little bit of an oxymoron in the healthcare industry these days, but really knowing that we make a difference in people's lives. And that's what it's all about for us. So I think similar to many other companies on this rapid growth phase, it's really figuring out how to scale and making sure that you have your infrastructure in place to be able to scale. We also had the unique experience of having the Affordable Care Act and primary care all of a sudden hitting the limelight as no longer the evil stepchild, as a specialty, and sort of the specialty from a shortage of healthcare providers as an additional variable. We've overcome it in a couple of ways. Number one, we've hired some great talent to help in terms of creating those infrastructure sort of foundations that we need to scale. But I think also we offer a very attractive alternative for practitioners to really practice medicine the way they want to and the way that they were trained to. And that has helped us be competitive in this marketplace in really getting great talent. I think if we look at the Affordable Care Act and see that we're making access really easy, nobody's dealing with the cost side of healthcare. And what's exciting to me is that OnSite solves that cost of care problem. It's not for everyone, it's for employer groups, but we're solving that problem, and that's exciting to me because at the end of the day, it does come down to cost. And we have a really viable solution that doesn't take levers in terms of taking away care from patients. It's actually better care for patients, which is where I think we should go. So I say to people, somewhat tongue-in-cheek, somewhat not, that we should probably be a case study for business of what you should not do in business, probably most mistakes that we've made. So lessons learned is you really need to have your foundation in place before you decide that you want to scale, rather than doing it as you go along, is a really important life lesson. I think the other thing is taking time when you're investing in talent. is that taking those extra few weeks to vet more candidates to really get the right fit. Because the worst thing is to have a bad hire than to have a no hire at all. So I would say those are two of the most striking examples of what lessons learned for OnSite.